That's a good one.
Was a good one.
Yes. Good. Drop it down. All the way down. Little push. Do that again. Good. Breathe in and out. Perfect. I'm so excited for today. We have a special guest today. She's a local superstar. News, an anchor, news
Reporter.
reporter.
Sometimes anchor, fill in.
Yes,
Yeah.
you can see she's good on camera, but she came to me with some hip stuff and actually was referred through Shockwave. So we're going to do that in just a minute. But let me see how you're feeling and we'll just chat while I take a look at you.
Yep.
So you're going to turn, face this way. Perfect. So I didn't start with chiropractic. All I did was the Shockwave. And then I started looking at you and started doing some little activator adjustments. But today is her first like full-blown chiropractic check. So now you get everything. You get the works.
Perfect.
We're gonna figure this out. Okay. So we were talking off camera, just getting an update, and I automatically. So forgive me as I go between chatting and then what I see.
Yeah, yeah.
I'm just.
Yep.
So this is what's happening. Everything. Your right hip is lower than your left, and this is all like doing that. And you're having most stuff on the left-hand side, correct?
Correct, yes.
So that tells me a lot. You're bearing a lot more weight on this longer leg, and so that force is coming up through the heel, the foot, the knee, the hip, and now we know you have a torn labrum.
Yes.
Bummer. But we're gonna keep running.
We are.
Yeah.
We're not stopping.
Yeah. Tell me about that.
So right now we are training to start official training for the Boston Marathon in April. So I'm just kind of building back my mileage right now, getting a good base so that I can start my official training come January.
Okay. And we have a goal. You've qualified, so...
I've qualified, yes.
Sorry.
Qualified, been accepted, but still going to try to PR there and re-qualify. So, got to stay healthy.
I love it. I love it. So, any tenderness if I push here?
No.
Any tenderness when I push here?
No.
Okay. How about as I push right in the middle?
No.
Good. Anything here?
Nope.
Okay. So what you started with was left hamstring.
Correct.
And then we've done some work on that. Shockwave has helped with that. You're doing PT and we're working on strength. But we also know the labrum's torn.
Yes.
So, I don't pretend that I'm going to fix that, although the Shockwave can help with that. There's some regenerative potential. But what we want to do is get you balanced, I think.
Yeah.
And so that all the forces, you're not working so hard to stand up, let alone run, right? Which is basically jumping from one foot to the other, which takes a lot.
Right.
And right now I can see you're really going down on that side. You're not having a lot of pain in some of these tissues, but let's see how they move. So raise your right knee to your chest and down. Okay, and left knee to your chest and down. Good. So neither of those are moving very much.
Is that good or bad?
Well, usually, so if I've got my hands on your pelvis and you lift up one leg, I want to see my fingernail do that.
Gotcha.
Nutate, counter nutate, right? And if you go forward, I want to see them go forward together and back.
Okay.
They didn't.
They didn't move. Oh, okay.
very much. So,
perfect.
So you're putting, there's a lot of pressure going to other places than it should be.
Okay.
All right, so now let's bend forward, touch your toes, and come back up. Yeah, and that's not even, so we definitely have to work on that mobility. Okay, bend forward one more time.
Okay.
Good, and come back up. Good. Any issue with that? How'd that feel?
That felt fine.
Felt fine, okay.
Yeah.
And then you said you did hills, and you had a really hard day.
Yeah. Bad hip day.
And preceding that was heel wearing for work.
Yep.
And a different schedule, and you just ran, and then you ran kind of close together.
Yep.
So I'm going to first check a squat. I want to see how your body moves in a squat. So this is a squat ramp.
Okay.
Just takes some of the pressure off of knees. Allows us to focus up here on the pelvis and see what we got. But we're going to be here, and then I just want you to come down and do a squat and kind of sit here, and I want to see how that feels in the hip.
Okay.
In the back.
All right. Yeah. So just squat down?
Just squat down. Yeah. So as I'm looking at you from the backside, everything's like rotated because I can see way more of your left leg than I can see of your right. So there's a lot you're doing a lot of compensations.
Okay.
Stand up, stand up. How did that feel to you?
It felt fine.
So you feel
no
fine
issues.
in that. Okay.
Yeah, it
okay.
didn't bother anything.
All right, and then let's do that one more time.
Okay.
Go ahead. And then come back up. And one of the things the hip surgeon guy said was that this hip, doesn't have a very good relationship, right?
Correct.
You can step forward.
Yep.
I thought I was going to sneeze. So there is some, it's
Of an impingement. Yeah.
an impingement. I was going to say banging against each other, but
That too. Yeah.
those are my official doctor words.
I like it.
I don't know. I just tend to think about like what that looks like. What's happening in there? And if I say impingement, it doesn't mean the same
no.
thing. Okay, so let's try this,
Okay.
because we talked about what's common in all of the things that you're dealing with. It's all on your left side,
Yes.
because you're also having some left knee pain. And as I can see, you're bearing more weight on the left side. That's longer. So you're working really hard.
Mm-hmm.
And then your feet. We're going to look at your feet and see how they are. So before we do the adjustment, we're going to check your balance.
Okay.
So do you mind taking off shoes?
Nope.
Trying this.
Mind.
And I'm going to do it with my shoes on.
Okay.
The best is with your shoes off, but kind of we're gonna find our balance here. And the idea is you're gonna be shaky and moving, but balance is kind of like where we are in space. Knowing where you are in space is super important. So, and it takes a minute. It's okay to wobble, and you're just trying to find. You're never gonna be completely still, but the idea is to be relaxed and just be. So we're gonna check it before and then after.
Okay.
Alrighty. So, and then use the wall if you need to. Good. That's actually really good. You think you can do 1 foot?
On the side or in the center?
In the middle, in the center.
Okay.
So
I'll
step
try.
off. Yep, perfect. So that's right. Good. Okay. And then let's.
I'm like, I already know, I think, how this side might
And
go.
that, you got a wall there, but
Oh,
there you go. It's definitely more wobbly.
yeah.
And you do have, I mean, when there's an injury, there's lots of messages happening. So,
Right.
But let's see if we can't get it a little bit better.
Yes.
With the adjustment. So, okay. And then the other thing, have a seat right here.
Okay.
I'm going to take a look at your feet before I do the
Where would you like me
adjustment.
to face?
Put your feet at that end.
At this end?
Yeah.
Okay.
Perfect. Okay. So I'll just slip this off.
Yep.
And you're going away on a trip, right?
I am. I can't wait.
What are you going to go do?
We are going to the mountains in Tennessee.
Mm-hmm.
So we got a cabin like just outside Gatlinburg, and we're going to take our dogs, and
Oh, nice.
I can't wait.
Good. So good arch. Do you ever have feet problems?
No, just toenails from running.
Right. Yes. Oh, yeah. Yeah. So a little bit of a, here. So I want you to try to spread your toes apart. Okay. So we don't get a lot of the big toe splay, right?
No.
So we want them to do that. It's very common that it'll come forward instead of going out. So there's things that I can show you that we can work on. The stronger your feet are, the better.
Yeah.
I mean, strong hands, strong feet, super important for everything. So that's why I like to check this before, and then I'm gonna go ahead. We'll go through. I'm gonna adjust you.
Okay.
And we're gonna go full spine. I start at the bottom. I work my way up.
All right.
Have you been adjusted before?
I have. It's been a long time.
Okay.
So
it's a little different. I may use the activator still in some parts, but then I may do some more
Okay.
Manual treatments. We may get some cracks. Who knows?
Yep.
But I think it'll be fun to kind of see if we can't get a little better balance.
Okay.
And then see how that affects the tissues.
Sounds good.
Yeah, because you want to get through Boston with some pain management.
Yes.
Or doing what you can to get there, finish that, and then make decisions about
Exactly.
what kind of repair, if anything.
Yes.
Perfect.
Yep.
I think that's a good plan. So let's go on your stomach.
Okay.
Face right, turn over on your tummy.
The mic, do you want it?
You're good.
Are
I'll
we
move
good?
it.
Okay.
I'll move it if we're gonna try to find some cracks.
Okay.
Unless I need to move it now. Okay. I do what I'm told.
Oh,
I got it.
Okay.
Good. You're good. I'm just gonna flip that on you. And you get to relax. And what's so fun about this is that you're not meeting me for the first time
Right.
and going on camera. Because that's not easy. You know, when you first work on somebody, it takes a little bit, right? You have to establish safety and trust, and
Of course.
but we've had some good chats, and it's been really fun. Yeah, because as an athlete, I think I appreciate any of the things that you're trying to do while working and planning a wedding.
Yes. Doing all the things.
Uh-huh. Well, what did you decide about the wedding?
We are waiting till after Boston.
Okay.
So
Mm-hmm.
Boston is priority number 1 right now.
Aww. And did you decide, are you going to do a wedding or are you going to do something?
So we've talked about doing a wedding, and then we went venue shopping, and it was a little bit of sticker shock, I think.
Yes, yes.
So we'll see. We definitely want family, close friends, but we also don't need to go crazy and
Yeah. Yes.
spend a lot of money. So
Yeah.
something intimate and special
Yeah, I
is
think
the main
that's-
goal, whatever that ends up being.
Absolutely. I think that's a good choice. And then you can go do something.
Yes.
Or
Exactly. The honeymoon's very important for us. We like to travel, so.
and so this weekend you get to relax.
Yes. Can't wait.
Good. So I'm just gonna test your pelvis. So I'm gonna touch your butt. There we go. I like to warm people. Here we go. All right, so confirms what I found when you were standing up. We're gonna start with that. So I use my activator there. And what I'm doing is just reorganizing some of these compensations that happen
Okay.
throughout that lower extremity. That's a good one.
It was a good one.
Yes. So now I'm just checking for the relationship with the femur.
Okay.
That's interesting. So this is the one that needs work, but I'm going to also adjust this right one.
Okay.
And I adjust full spine, even if it's one thing.
Okay.
I can't pretend to know all the connections that are happening in the body and connections of, you know, how much does this right hip being externally rotate affect how this hip feels and works, and how your feet. So I like to find all those connections, and we may even do something other and check, because I'm doing more learning about the tongue and what the tongue represents in the body. And
Oh, what can that do?
well, we'll see. We'll see if we go there today, but I think it's just one of the it's information,
Yeah.
you know. So I like seeing, like testing. Let's try this. And I'm just looking at your sacrum. So we're gonna make that a little more balanced. You probably sit with crossed legs at times, yeah.
Yes. I've tried to stop because I have noticed it aggravates my hip, but
Yes.
it's a hard habit to.
Good. Okay, so we're gonna test a couple things. Squeeze your butt together, release. That checks the coccyx. That looks good. Squeeze your knees together, release. That checks the pubic bone. That looks good. Recheck this left hip. So my test on the initial was that this was neither rotated in or out, internally or externally, but kind of coming out lateral.
Okay.
So let's see what else we can do here. I want to see. So I want you to lift this right leg straight up to the ceiling.
Okay.
As high as you can. Good. And then down. Now do the left one. Did one side feel easier than the other?
Actually,
Or about the same?
about the same. My left side almost felt a little easier.
Yes.
In the right side, I felt a little pinching in my lower back. When
Yes.
I did it.
Yes, I did. It's very slight. It wasn't like a huge
Yeah, it wasn't,
difference,
like,
but.
huge, but I noticed a little.
And I think if we get a little more motion in that SI joint, it'll help. All right. Now we're going to take a nice deep breath in here. And you're going to let it all out. Good. Drop it down. All the way down. Little push. Yay. Breathe in and out. Good. Let it go. Good. You know, breathing is good for running, right?
Yes, it is.
Breathe in and out. Let the shoulders drop. Open up. Yep. Good. Little tiny little pops, but good movement. Really good. Now, tell me about any head, neck, shoulders.
I haven't had any issues so much. My right shoulder has occasionally bothered me, but it's been all right recently.
Little stretch. Good. So let's check that. So what's the most interesting thing you've done on the news lately?
Oh gosh, lately.
It was the storm. It was the storm, right?
Lately, it's been storms and elections,
So maybe it'll calm down. You'll go back to
Yes.
looking at school air conditioning problems.
Exactly.
Well, what do you like better?
Oh, definitely the normal stuff. We're
Yeah.
all
I think I can agree with you. The storm one
the
would be.
storm, and then right into elections. That was a lot for everyone.
They should just have one channel that does it.
I agree.
Because then everybody's doing all the stats and this is blue and this
I
is
know.
red and
Watching, it's like, ugh.
yeah, that's something else. Turn your head now. Look to the right.
Okay.
Yeah, we're working our way up your spine. Head back to the middle. Shrug both shoulders. Relax. Good. Okay. And look up and down. Good. Chin to your chest. Back to the middle. And when you go on camera, do you have like a makeup person?
Oh no, me.
You do it. Push your face into the paper. Push down and relax. Good. All right, I'm going to adjust the occiput on the left. Push your face down and relax. So you kind of have figured out how to do it all?
Yes. And a lot of times more of just how quickly can you do it. Time is of the essence.
Right. Well, I think sometimes what surprised me about doing this channel was one of the main comments is about my hair.
Oh.
Whether it's
Yes.
up or it's down or it's
Yes.
I'm whipping it around or
I know. And it's
and I'm like, I'm just working.
very frustrating too. And after so many years working in news, the viewer emails you get, some can be very hurtful. You have to get a thick skin, but
Is that right?
they sometimes
They have opinions about
I've
things?
seen, oh yes. And it's never usually about the actual content, like what you're trying to tell them. It's about, oh, that dress or your hair or that shade of lipstick. It's,
For real?
yeah.
Oh. Of all the things in life to
know.
send
It's
an
like,
email
oh,
about.
story that I worked really hard on and
And stood in front of the camera and delivered, which is not easy to do, by the way.
I've seen a lot of other reporters in different places and stuff posting on Twitter too, where people just be very mean. and send about their weight or their, just appearance, and it's, I don't know, not nice.
No. No people can be not nice sometimes.
Yes, they can.
Yeah, I tend to not have very thick skin.
It's hard. It's like you try to, but it's still, we're all human. Like it bothers you.
Yes. Yes. How'd that little feel on that shoulder?
That felt really good.
So I'm going to come down and do a little bit in the lower back just
Okay.
before I do the SI joint adjustment. I just want to see if we can't. See if there's anything in here. Just kind of going over all this. This is where the tailbone meets that ilium, or people call it the hip. Yeah.
I've had different times where that area has bothered me.
Mm-hmm.
Just kind of depending, I guess, on activity, or sitting seems to trigger a lot of pain for me.
For sure. We're just not supposed to sit very much.
Yeah.
Good. Yeah, I'm not getting a little more on the left side. Mm-hmm. But let's adjust that now. So I want you to lie on your left side, face towards the window.
Okay.
Good. You're going to bend this top leg and you're going to bring your butt towards me.
Okay.
There, good. All right, you're going to hook that and I'll take that arm.
Okay.
And we're going to do a little stretch, a little pretzel. And out. Let that drop. Let that drop. Good. Okay, go the other way.
All right.
Little baby. Little baby crack, that's what I meant to say. Good, and bring your butt towards me.
Okay.
Now, does this hurt your hip at all?
Mm-mm.
Okay.
Right.
So we do a nice stretch.
Did
it?
Yeah.
Good, so that was, let's see if there's anything else in there. So we're going to do a nice little, again, do that again. Good, breathe in and out. Perfect, that was good.
That side had lots for you.
I had a lot to say every time on the left side. So if that side is more limited in the motion, that's going to affect.
Yeah.
Put more pressure on the hip, right? So we're going to check your neck.
Okay.
You're going to be all fixed up, a new woman for your
Right.
good vacation. How long do you get to go for?
We come back on Thursday, so almost a full week.
Good. Do you turn off your phone and stuff? Or do you have to keep it on?
Hmm?
Do you turn off your phone?
Oh, yeah. The work phone. Yeah.
Okay.
I don't want it.
So no headaches, no issues with the neck, really.
No.
Good. So we're just going to clean up some of this in here. Gentle stretch. You're going to drop your right shoulder towards your ears and let that drop. Yeah, let it go. Good. First time we did that?
Yeah?
How's that?
Not bad.
Good. Drop that. Yep. Very good. Excellent. One of the things that there's a connection between is the occiput and the hip flexors.
Oh.
So let's just check that.
Okay.
You're going to hold this leg up strong. Don't let me push it down.
Okay.
Good. So that one's, the left is okay. Hold
Yep.
that up. Don't let me push that down. Good. So each individual, they're okay. Let's see if they're together. And hold that up. Okay. Not bad. You could do it.
Yeah.
was a
That
little
got
sore?
my hip a little. Yeah.
Okay. So let's look and see if there's anything else I need to do in the hip. So first, I'm going to gently push it in. Hold it out there. Don't let me
Okay.
move it. Good. Any problem with that?
That was fine.
Okay, let's try to use this leg. Hold it out and pushing in. So yeah, I'm moving it in. You're gonna hold it out. So push against my hand. Yes,
okay.
just like that. Perfect. You got it. You got it.
Figure out
Push
my
against my
direction
hand.
first.
Yes. Yes. Good. Push again. Let's check this knee.
Okay.
Hold the leg out. Good. Hold here. And hold here. So it's not bad.
Yeah.
There's a little bit of rotation in there. I'm going to check. Because what you were noticing was On the outside here?
Yeah.
Okay. Hold that out strong. Okay. Yes, just like that. You're doing great. Yeah. Yeah. Good. I just want everything to be strong.
Yes.
Aligned and balanced.
Yeah.
Good. Even more ankle. Did you feel that in the hip?
Yeah.
Was it okay or was it painful?
It was fine. No, it wasn't painful.
Good. Let's try this one. I'm going to grab a tissue. One more time. Let that drop. Yeah, let it open. Yep. Good. Got a little more there, right?
Yep.
So, not to add to your PT, because I know you do a lot of exercise already. But before I check, one more thing, I want to look at your toes.
Okay.
Where'd my little toe thing go?
What is she looking for?
There's this almost like a way to kind of correct if you had like a full-on bunion. You know, how sometimes the big toe goes this way.
Yeah, yeah.
Oh, there you go.
Okay.
So, I'm not, I'm a camera person. So the other day I went to get something and I walked down the hall and he kept the audio on so you could hear me do
Well,
Okay.
the thing, when I anchor, I have to watch out that I turn the mic off when I go to the restroom, because sometimes you just have like commercial break or something,
Yeah.
a quick, so I'm like running in and I'm like, I don't want them to hear me peeing, like everyone in the audio guy, like.
Sit up for a second. Here. And we're going to put this over the big toes.
Okay.
You don't have to have this to do the toe exercises, but I think it's illuminating.
Okay.
So we're going to let's see what happens when we pull out. Good. How's that feel? Do you feel that in there?
No, actually. Well, a little bit up top on the right foot. I feel it in my like quads, kind of. I'm like,
Well,
I think I'm really going all out on this. Like trying to. My quads are like, I got this, toes.
okay, so let's see. So I want you to kind of bring your ankles here. And then while you're pulling apart, you're going to do like that. And now go up and down with your feet. So then we're working. And it is possible you are activating all the way up into the quads. We're going to do that. And then the other thing I want you to kind of, when you pull apart, and then I want you to kind of rock in and out. So turn the feet this way and then maybe that way.
Oh, okay. Like so go that direction. Okay.
Yeah. In and out. So you are working all the way up while activating
harder
the toes.
than it looks. Like,
yes.
Oh my gosh.
And if you get a cramp, so we'll take a break here.
Okay.
But so I'll give you there's 4 ways to do it. One is to have it on the toes and then lift up.
Okay.
And then the other one is to go in and out. And then the other one is to go up and down.
Okay.
Like that. So, or 3 ways. So if you just remember those 3 things.
Yeah.
Even if you don't have this and you just get a rubber band or something with just some resistance, that starts at the bottom.
Okay.
And it may help give you better proprioception and balance from the bottom up. Sound good?
Perfect. Yes.
Okay, so then the last thing, so we've checked all the things you talked about.
Okay.
So sit and face that way.
Okay.
So we're going to do something funny. We're going to check your tongue.
Okay.
Just because everything was so one-sided, I'm curious, because the tongue is a long muscle.
Yeah.
It goes all the way down, right? So there's a lot of fascial connections, and it can impact a lot of things. But so I want you to stick your tongue out. Good. And then I want you to, can you twist it? Uh-huh. Uh-huh. And then go the other way. Uh-huh. You keep doing the same side.
Oh.
So okay, there you go. Okay, so you got a little, now does one side, it takes a lot of thought. Isn't that interesting though?
Yeah.
It's like,
Yeah.
Can you do that?
Try using the mirror to kind of help you.
Yeah.
Okay,
so
it feels like that side rotates better.
it feels much easier going that direction.
Correct.
Than that direction.
Than that direction. So
yeah.
going to the left feels more resistance. That way. That way feels more resistant?
That feels easy.
Easier. Okay. Mm-hmm. Yeah, I can see that. All right. So do we want to try something funny? Because I did this. I did it on myself, and then I did it on him.
Oh, okay.
And actually, I did it on another.
Bumps.
Yeah, I did it on another one of my patients. Oh wait, maybe I have to go get those now.
So the tongue thing is very revealing as far as like where your, and this is gonna sound funny, where your insides are and
Okay.
where you're kind of like laying.
Okay.
Where structurally where the body may be
Okay.
adjusted the wrong way or.
Yeah.
So you have to find a way to balance it out. And the tongue is very revealing as far as like once you fix your tongue, everything else kind of follows.
That is so cool.
Yeah.
I love it. I'm like so into all that stuff. I was reading, it's funny with the toes. I was reading, it was something, I feel like maybe it was on Instagram or something. It was running related though, and they were talking about how important it is to have a strong big toe. Big toe specifically.
Yes.
They said in the big toe, the amount of force it takes on is incredible.
In the toe
like,
off? Yep.
200 times your body weight, or it's something insane.
Yeah.
And they said like your big toe, you want a strong big toe. Like you don't realize how
Right.
much it does
Right.
and how important it is.
Yeah, and then when you don't, then you end up with that bunion type of a alignment.
Oh,
where
okay.
it bows out, I think, to give more stability.
Right.
And then puts down bone.
Right.
Actual bone in that area.
Ugh.
We want to avoid that.
Yes.
So we're gonna test this out.
All right.
So you're gonna just kind of be as relaxed as you can, and you can cross your hands over you.
Okay.
Around you.
So like all the way?
Yeah, just
Okay.
to kind of relax, and we might do a little bit of a twist. So then
Okay.
you're gonna just stick your tongue out, okay? And
Remember to be gentle.
okay, and not pulling. Is that okay? You okay? Okay, so I'm gonna do a gentle. How's that? Too much or? This feels weird, doesn't it? Okay. So this way is easy. Okay. And if I go the opposite direction, yeah, there is more resistance. So then I want you to kind of just gently twist just your body. Good. You can drop your head down just a little bit. How's that? Are you okay? Good. Good. So I'm just doing a gentle pull and rotation. Working to release. And we've got to hold it. So if you're okay, just keep breathing through your nose. Good. And then let's do a little more twist. Yeah, good. Good. Besides being very weird.
A little strange.
So let's see how we do. It's a lot easier for you now.
Yeah.
And even some of that neurologic thinking about like,
Yeah.
what. So I don't know. We'll just have to see how that
Yeah.
how that relates to the rest of you combined with the feet work. So let's stand up. Let's
All right.
actually check balance. And let's go back over here so
Okay.
we don't run into stuff. All right, let's try this.
All right.
Yeah, so you're already pretty good at 2 feet.
Yep.
Yeah.
All right.
Yeah, so let's try.
Try.
Let's do your right, because you're good at right also.
Oops, spinning on me. Okay, there we go.
I like how the relationship of your toes on the board. You have good. You're not curling your toes up, gripping it.
Oh, okay.
Sometimes people are doing this, and the idea is here to get that suction cup and feel that like equal distribution through the toes. Feel that little that's what holds us up right there. If we're doing this, that's putting a lot of pressure.
Okay.
So that was good. I liked how you were doing that.
All right. Nope.
You're good. It might take a minute. But I mean, you're way less shaky. And I think that big toe is probably the weaker of the toes.
Probably.
So what we'll do is we'll just, you have a little homework.
Yep.
You can do the 3 toe exercises with a little resistance. Yeah, just keep it real simple. We'll do that. For the hip, you're doing a lot of PT and we're trying to keep running. So we've talked about a few things like activating your glutes.
Yep.
So making sure that the glute is what holds you up.
Yep.
Not the little, small lower back muscles or joints. And that's kind of the start of your core. When you're running hills, one of the tricks I learned was to tuck and push through your sacrum,
Okay.
because then you're using your glutes to drive yourself.
Okay.
Right.
I'll have to think about that next time. Yeah.
Instead of so much weight being on the hips, our muscle is our armor, right? So
Right.
that's what holds us. When you're running, you're just gonna kind of just pretend you're pushing yourself up the hill with a little bit on your tailbone.
Right.
So try that.
That is something in PT that he noticed too.
Yeah.
Is that my hips, when we did a squat, my hips weren't doing the turning.
Yes.
They were staying stiff,
Yeah,
which
okay.
you
So
noticed too.
Yeah, we were
I
saying
just
the
thought
same
about
thing.
that.
Oh,
Yeah,
perfect.
where they're
I love it.
that movement, they're
Face that way.
they don't
Let
want
me
to
see.
move.
Yes. Okay. Well, let's see if we've changed anything in just this one
Okay.
time. So you're way less tippy.
Yeah.
And that's also the technical term.
Yes. I like it.
Now raise your right knee to your chest and down. And wow, that was a big difference. Left
Yeah.
knee to your chest. Perfect. So both sides.
Yeah.
Really, really good. Let's
Good.
just bend forward one time.
All right.
Okay. And come back up. And this time they're together. Last time
Okay.
there was a little bit of like,
Yeah.
so this time it was boom, boom. And then I saw good motion on the right and on the left. So,
Perfect.
So yay, I think that's a good start. And then we're going to just do the soft wave on hamstring and the low back.
Okay.
Just to see if we can't
Sounds good.
give you some relief
Cool.
to train. So good.
Perfect.
Okay, we'll go get that set up.
All righty.
Perfect. Okay, so we're just getting Fallon set up for the soft wave. This is the machine. The tissue regenerative technology machine that we invested in, and it's amazing for really so much. Things that I'm limited by in chiropractic, but say knee, pre and post surgery, or somebody trying to put off surgery, feet, plantar fasciitis, hip, we've been working on the hips. Today we're gonna just focus on the low back and your left hamstring, just because the hip gets a little bit showy.
A little up close and personal.
Yeah. I told him, I was like, it's kind of like a wax. It's just shy of a
Yes.
wax. We're not going to do that today. But as I tell everybody, and as I told you, Shockwave delivers a sound wave very fast into the tissue, so it penetrates deeply. Does three things: brings blood flow to the area, reduces pain, and creates an injury that the body then sends stem cells. So that's where the regenerative potential comes from. And the healing that can happen while we're doing the treatments, we typically do anywhere from 6 to 10. And after 10, it's still another 12 weeks of healing that your body is doing on its own. So you're gonna feel a little light, but there is no electricity. This is not electricity, right? And Fallon's going to tell me what she feels. It's seeking out inflammation in tissue, so we're going to just find that, and then we're going to deliver pulses into there. You ready?
I'm ready.
Let's go. Ready, set, go. Okay, so I'm just going to kind of acclimate you to the machine. You noticing anything
That little area.
in here?
Yeah.
So just tell me some numbers, anywhere from 0 to 10.
It's getting a little better. I would say it's not super painful, so probably a 3-ish. That's something there.
Okay, so we're
That's
right
a little-
over, we're right
yeah.
over that sacroiliac joint.
3-ish, 3.5 maybe. It almost feels like it's sore, kind of like if you work out and you feel sore and then you push on it, it almost feels like that in that one spot.
Right, and you're like, yeah, there's something there.
Yeah, like something there.
Okay, how we do up as I go higher in the low back? Anything?
A little bit to the left, maybe. That's all right.
Feels
Yeah,
pretty
it's still
good.
that spot is definitely something.
So we're gonna just
there.
do several right here,
Okay.
because we want to feel it to heal it.
Right.
And we've done 8 treatments, so
Yep.
your intensity is up a little higher than when we started. Okay, so that was like 30. How is it here?
That feels all right there.
Good. Okay. as I go up the spine, anything?
That's all right.
Okay, so let's come across and check this right side.
That's a little something there.
I'm excited to see how you feel running with the increased motion that we have now.
Yes, me too.
All right, and anything in here?
That's a little something. The left side was more.
Okay, so what, you're
Felt
about
more.
a 2 there?
Yeah, like a 2.
Okay.
That is something.
Okay.
That's, oh, yeah, that's more of a 4 maybe. That was a sharper one. It's getting better now. That's all good. That's still a little something in that area, yeah.
Okay, we're about halfway there.
Okay.
We're going to do 800.
That's a spot. Right there is definitely a spot.
And I feel like it's kind of like where the itch is. You're like up, up, down.
Yes.
I can just change the angle and I can change what tissues the waves are hitting.
Right.
But yeah, I had a guy, he was supposed to get his knees done and didn't want to get it replaced. And so we did 6 treatments here. He's doing okay. It's not perfect. It's not like it's magic.
Right.
But way better than he was. Way better range of motion, almost right away. Reduced pain.
Well, on my hamstring, when we first started, I couldn't touch my toes.
Right.
And if I did, it was very painful. And now that's not an issue at all for me. That is something there too on that side, yeah.
So every time I come over these SI joints, that's where.
Yeah. Oh, okay. That's what that is.
Yep. So even though there's better motion, there's still some inflammation and tissue that needs healing. So. So what did I say? Increased blood flow, decreases inflammation, and then sends signals for the body to produce stem cells. So it's pretty cool. You know, it's a big investment, but I like that some of the cases that I was limited by, whether it be a hip labrum or torn meniscus, other tears, plantar fasciitis. Oh my gosh, that is so hard. I love this for that. I have plantar fasciitis. I did everything.
I've been lucky. I've had little bouts where I kind of feel something in my feet, but thank goodness they don't stay.
Yeah. So if you ever sprain or twist your ankle, come see me right away.
Okay. I wish I would have known you several years ago. I twisted my right ankle pretty bad. And I was put in a walking boot for 6 weeks, and I think that was not good for me at all.
Well, it's because I did that. I sprained my ankle really bad running in Hawaii. Flew home, couldn't hardly walk on it, didn't treat it, kept running on it, kept wearing heels at the office. Tell me you're young and dumb without telling me you're young and dumb.
Yeah, right?
But, oh my goodness, that's what started it.
Yeah.
So it's kind of, you don't take care of it, your body will invite you to take care of it.
Yes.
Okay, so we're going to just run through this hamstring, then make sure. Okay, so we're going to start up at the top. I am going to go through the whole thing.
Okay.
So I'll just make sure we got gel. Good. A little bit. Perfect. So you just tell me same thing.
Yep.
What number we're at.
So far, so good.
Good. Yeah, most of the time, this is where we spend a lot of time, right here, right at the attachment,
Yeah.
right?
Yep.
But sometimes we go down and anything through here?
It's weird because I'm feeling some of that more on the front of my leg again, that is something in there.
Okay.
But it's almost, I kind of feel it in my, like deep in the hip area.
Okay.
And now it's lessened, so.
So I may be able to get some of the hip from this angle.
Yeah.
Just depends on how deep we can get. Because I'm on the medial part of the ischium with it angled towards the hip. That's where you were feeling it. How about if I come down here? Anything here?
No, that feels good.
Good.
Yep, nothing.
Okay. So we're going to just scan down again.
Down at the bottom there?
Yeah, here.
Yeah. And I'm feeling that almost in the front and the top of my knee.
Okay.
Oh, yeah, that was a sharper one.
Every once in a while there's those like
A little jolt.
super ones. I'm not sure why, but. Anything over here?
That all feels fine. Right there again, it's still in the front. Like it's kind of hitting the same spot above my knee, which is strange, but. Yeah, that too. I'm feeling this all in the front.
And to be honest, I don't know why
Yeah.
you'd be feeling it on the front, except for the sound waves are penetrating deep, and so there may be some tissues in deeper
Right.
than the surface level part of the hamstring that
Right.
have some maybe micro tears or at the very least inflammation. So, good. We're at it's got about 400 to go.
Okay.
So halfway through with the hamstring. Anything in there?
That feels all right. Yeah, maybe a 2-inch, like a little more to the left. Center. It feels good now.
If I angle
Yep.
there, does that change it?
No, that feels fine.
Okay, good. A little bit over here. See if anything, as they come out lateral.
That's all okay. That's all feeling all right. It's all feeling good.
Good. Yeah, that was a lot smoother that time. I didn't
Yeah.
feel resistance like I did the first time. Nothing on the front side there?
Nope, that feels good now.
Good. We're going to do about 50 more.
All right.
Good. Well, you got the works today.
Yes. I'm all fixed up now.
You are. You're ready to rest, to feel good.
Yes.
You're still going to run on your vacation?
Yes.
Good. So you just report back
I definitely will.
after, and then just see how this all goes and what you notice that's different from when we're just doing soft wave.
Yep.
You know, you can get sore from an adjustment. That's normal.
Okay.
You can go ahead and hop up.
All right.
It's not a bad thing. It just means that we move things around.
Right.
So if that happens, it'll just feel like exercise soreness. Same thing with this.
Okay.
For this, I wouldn't use any ice on the
Okay.
low back or the hamstring because we want to keep that blood flow going.
Right.
So that's part of what we really want to see.
Okay.
So other than that, everything's, the same. So we'll see you. We'll have you come back. Maybe we'll do some follow-up. We'll kind of follow you through this little journey here and see how we can get you for Boston.
Perfect.
Good?
Sounds good.
Anything
Thank
else?
you.
Anything else I missed?
No, I'm
We
good.
did tongue to toes.
Yes, we did.
So thank you so much for
Yes, thank
It's
you.
always great to work with you. So everybody out there, if you like this, like and subscribe, and we'll make more.